Morning, there are three quick briefs we want to take. We'll take one from the Ghana Health Service, updating us on our latest numbers and particularly the daily increase. Remember the last time we engaged, we talked about the fact that the average or the 7-day moving average was somewhere around 250, was going to 300, and we were all worried about the possible consequences. So they'll give us the latest numbers with particular emphasis on the average daily increase and what it portends for us. There's also a new directive on the cost of tests that needs to be clarified, and they will be doing that for us this morning. The Ghana Education Service, as advertised, is also here with us this morning. Professor Kwesi Opokwa-Mankwa, Director General, is here. He's here with Dr. Kwabna Tando, who is Deputy Director General, Quality and Access. They are here this morning, but Prof will be speaking to us about the reopening of schools and their early monitoring. You recall again, the last time we spoke, we mentioned that it was necessary for them to do the opening and then the monitoring so that they would know what is going on and how they are handling it. So he's here to give the country an update this morning. The Ghana Police Service is also here with us this morning. As advertised, they've been, since update number 22 by His Excellency the President, they've been doing a number of things to ensure higher levels of compliance. Superintendent Mrs. Sheila Abeye Bachman, Director of Public Affairs, is here with us, and she'll also give us an update. Maybe she'll go back and tell us all they've been doing from March before the current specifics. So good morning once again and welcome. I want to start off with some quick comments, and then I will go to the Ghana Education Service to give us their brief first. The government of Ghana wishes to thank the Ghanaian public for its cooperation during the activities commemorating the final funeral rites of former President Jerry John Rawlings. In particular, we note the public's compliance with the COVID-19 preventive etiquette and the public's heed to the call to, as much as possible, follow the events virtually, which resulted in the avoidance of large crowds at the event. Government also commends the media for your cooperation, your professionalism, and your in-depth coverage during the activities. No doubt your extensive coverage and analysis contributed to the public's ability to comply and still follow everything that happened. And so we want to thank you and thank the Ghanaian public, and we look forward to some more partnerships in the future. Perhaps I'll take that one in three quickly, and then we'll move on to the other briefs. Anope, aban ebo Ghana fo nyina abaso se nhihyeya ye de to ho efa ye mampani da Jerry John Rawlings na yiyo eho no moboa ma yetumi edi so titiriu wonoma eba Independence Square ne Accra International Conference Center COVID-19 bambo nhihyeya ye nyina no omu di so krojin emayen na yeda o mase san so da mose se abra ban tufo se ebe ya trafie na hwe e wo TV so no nipa dodo na e de ye adwuma nti ye hu se be nipa abodompem aboroso e wo bebia ye eniema ni nyinara Central Force aban san bom abaso se nhihya ye di gu ho nyinara mudi so mo hwe ye mo adwuma no ni mpempenso a na edimu pa na mutumi ebo dewro titiri mu anamo ye live ne ade mutumi bo dewro kirekire ne mamu ma obi otifie hwe kra no na onyane yi hwe wo fie nti ehun hia se obe ba conference center na se Independence Square ye damo ase na ye hwe nim se emrepom no adwuma foforo ba ye besan ne mu nyina aye abom. I want to invite the Director General of the Ghana Education Service, Professor Kwesi Opokwa-Mankwa, to give us an update on the reopening of schools and how they have been managing the issues that have come out since then. Prof, good morning and welcome.
Good morning, ladies and gentlemen. This is the first time we're meeting in this year, so Happy New Year, Afishapa. We want to give you some briefing on what has happened so far since school reopened. about two to 3 weeks ago. We may all recall that way back in March last year, the president announced the closure of schools. And this affected about 9.2 million children in private and public schools at the pre-tertiary level, and then about 500,000 of our educational workers. When the president announced the closure, he also indicated to us that we should find alternative ways of engaging students whilst they are at home. So we worked with the Ministry of Communication, Ministry of Information, we worked with our development partners, and we developed online radio, TV programs for people to engage in some form of learning, what we call distance or remote learning. Then in June 2020, the president announced the phased reopening of schools. There was the need for final years in JHS 3 and final years in SHS 3 to go to school and finish up with their examinations. Subsequently, in October, schools were also reopened for second years of SHS and JHS as well. In the course of it, the president indicated to us that all things being equal, schools will be reopened in January 2021. So we got ourselves ready for that. And in January 2021, specifically starting from 15th of January, we drew up a program for school reopening, and 15th and then also 18th of January. And so school reopened. President also directed that there should be spraying of all educational institutions, and we should also provide PPEs for all schools and all students and staff, both private and public. Now, as part of the reopening, as I've indicated, we disinfected all schools. We had our Veronica buckets, soaps, sanitizers, tissue papers, that is the wash facilities provided for all schools. We have our reusable face masks. We also indicated that there will be no mass gathering on school campuses, no sporting activities and sporting events. Dining hall will be attended in batches for senior high schools, boarding students, and then no outside activities. We've taken a couple of steps to ensure that the school reopening goes on smoothly. We have prepared what we call guidelines for school reopening, and we have distributed them. And the guidelines is on COVID-19. We worked on this with the collaboration of Ghana Health Service and our development partners to ensure that we have that guideline. We also have done what we call the recovery learning guideline. Students have stayed home for about 9 months, almost 10 months. And there was the need for us not to immediately go into the normal way of learning, but to have what we call recovery learning. For example, if you take the routine way of going to school, students wake up sometimes around 4 o'clock, 4:30, 5 o'clock in the morning, and they start their day, and then they come late in the evening. During the 9 months, some of them wake up around 10 in the morning, 12. they have their own different ways of spending the day. So if they are coming back to school, then there will be some level of trauma, there will be some level of anxiety, and things like that. So we need to find a way of orienting them into the new school system. Whilst at home, they may be watching the program that we put online and on TV and radio, but the form of learning that they are doing is an unstructured form of learning. They pick and choose the things that they need to do. But in school, you do what we call structured learning. There's a timetable that you have to follow and all that. And for 9 months, they've not done that. So there was a need for us to find a way of reintegrating them back into school. So part of the school recovery is to ensure that they go through these processes for them to come up to speed with the normal school life. We've also done a number of back-to-school campaigns. We launched an official back-to-school campaign at Manchabuena to educate, inform, and get people to know that schools are reopening. We have also, last week, visited schools as part of the International Education Day, the UN International Day for Education, all trying to get people to get back to school. We're working with Ministry of Information, Ministry of Health, to run a couple of adverts and programs on air to also educate people on the back to school, and especially the do's and don'ts as far as school reopening is concerned. As part of ensuring that we abide by the protocols, we've also worked with Ghana Health Service to do what we call school mapping. We've mapped out all our schools to various health centers and health facilities across the country. Said that whenever there is any issue, even beyond the COVID, the schools have been told where to go for some health support. We have trained about 52,000 of our key staff, the school health education program key staff, who work with Ghana Health Service to ensure that they also subsequently provide education to our teachers and then also to the students. We've also worked with Ghana Health Service to set up what we call task force, the health COVID response task force in our schools, to ensure that when an issue comes up, they will know how to address that. And as I indicated much earlier, we're working in collaboration with our development partners, UNICEF, DFID, USAID, World Bank, etc. They are supporting in various efforts, giving us various supports to ensure that we move on closely. Now, by way of update on the PPEs that have been provided so far, we planned, the program was that since this time around we are running a whole year program, we're going to give PPE, the face masks, we're going to give 2 each. We're going to give 2 each for the semester or for the term. And then subsequent semesters and terms, we will continue to do that. So far, if you look at the table that is out there, these are the things that we have supplied to the schools. If you look at sanitizers, you realize that it appears twice. We have hand sanitizers, and then we have gallon hand sanitizers. For the KGs, we decided that they were not going to get their individual or personal sanitizers. If you put those things in their hands, you may not be sure what they can use them for. So rather, we provide them in gallons, and then their teachers will put them in dispensers and then dispense to them when the need arises. In our special schools, we have also provided electronic dispensers. And then we have also provided face shields for the special schools and then for the KG, both the teachers and their staff. And we want to take the opportunity to actually thank parents. The distribution took a while, and whilst we were doing that, we were encouraged by the response that parents and also all students of the various schools and various other people in our communities contributed to providing some of these PPEs into the schools. Now, the next important assignment for us is to constantly monitor the schools and see how well they are doing. So come next week, as we did in the previous reopening, we're going to have teams from the national, from the regional, and the district levels to go around to monitor and pick out the issues as and when they come. And these teams at all levels include Ghana Education Service, Ghana Health Service, our local assemblies, and then our various staff at all the levels to ensure that we are able to do a thorough monitoring and give a good evaluation and resolve the issues as they come up. We also want to draw attention to the fact that the home learning support, the online, the Ghana Learning TV and radio are still working, and we will ask parents to encourage their wards to also go online or watch those programs or listen to them to support their learning whilst they are at home. Anɔpɛ mɛma mu nyinaa afihyia pa. Ɛm sɛ afi mu yɛsi mu ɛnɛ ne da edi kan a mene mu nyinaa mu ɛhyia. Nti ɛma mu afihyia pa. Bɛyɛ mmere bi atwam bɛyɛ bosome nkron ni. Ɛsan COVID nti aban tutu asukuu mu. Ɛna edu mmere bi na ebehia se ebebue ma nkwaraa na tumi akɔ ɔma na ɔmkɔyɛ nsɔhwɛ no. Ti ebue ma ɔmkɔyɛ nsɔhwɛ. Ɔmo mu di ɔmo akyi no nso yebue ɛyɛ from 2-4 ɔmo so kɔɛ ekosua adeɛ kakra aban hyehyɛ mu no nso ɔka me yɛte sɛ si yedu afefoforo no mu a yedu January a ɔbɛpɛ sɛ deɛ tipa bia na yɛde nneɛma bɛtoto akwan mu ma nkɔraa no atumi akɔ school nti ampara ɛno nso di so ɔde nneɛma toto akwan mu ɛma yebue school nti 15th January ɛna yɛma SHS for kɔɛ SHS form 2 form yɛ gold ɛna form 3 for nyinaa sisi a yɛka sɛ ɔmo nyinaa wɔ school ɛna 18 January ɛna ɔmo aka ne nyinaa so fi KG ɛkɔkɔpem ɛfra JHS for nso kɔɛ na ansa na ɔmo abɛkɔ no nhyehyɛ a yɛayɛ ato hɔ a yɛbue school edi kan yɛbue school ɛtɔ so mmienu yɛyɛ ne sɛ aban ma yɛkɔ bɔ school no mu nyinaa duro school biya yɛsɛ yɛbue biya efi class 1 a efi KG a kɔkɔpem university baabi a yɛkɔbɔ mu aduro deɛ bɛyɛ a sɛ COVID mmoawa ne bi wɔ hɔ no mu a anaa sɛ obi nso de bi ba hɔ no ma na kyerɛ sɛ atumi abrɛ no ase kakra ma yɛn ɛno akyiri no nso nneɛma a potɔkasɛm yɛsɛ PPEs no nso ɛno nso yɛpɛ bi a yɛsɛ yɛde ma schoolfoɔ no yɛma ɔmo buckets Veronica buckets yɛma ɔmo samina yɛde hohoro yɛn nsa samina no nsuo deɛ ne bi yɛma ɔmo sanitizer ɛde some de form nsa yɛma ɔmo paper so oyɛ yi wia de paper nsa ho ɛna yɛma ɔmo thermometer guns ɛne deɛ keka ho nyinaa face masks ne nyinaa yɛde bi ma ɔmo afi yɛn hyehyɛ mu no yɛn sɛ face masks no yɛbɛma obiara mmienu esan sɛ yɛbue school na yɛbɛkɔ school afi no nyinaa efi January yɛbɛwie afie no school afi no na kyerɛ sɛ ɛwɔ December nti face mask no ɔmo kɔ biara yɛbɛma ɔmo bi sese yɛsɛ yɛma ɔmo mmienu yɛdi kan deɛ edi kan no kɔ efi bɛyɛ 7th February na nneɛma a ɛyɛ sɛ san so kɔ no na asan so ato aso kɔ yɛsan so yɛ nhyehyɛe kakra school na ɔmo kɔ a yɛma ɔmo kwan ma ɔmo nkɔdi agorɔ ɔmo nka mbɔ mu bebree ɔmo nkɔtu mmirika no ne bɔɔl sɛm ne adeade boarding school foɔ no ɔmo adidie no yɛayɛ sɛ ɔmo nkyekyɛ nnipa no mu na ɔmo nkɔ no ebi kɔ a akyire ne ebi nso akɔ nkakra kakra a ɛno nyame adom ɔmo di so ɛma yɛn kɔfoɔ nso mfi abɔnten ɛma mɛyɛ nneɛma ɛwɔ school mu hɔ no mo nti ɛno nso yɛ nhyehyɛeɛ a yɛyɛɛyɛ ɛna yɛsan so etintim krataa ɛkyerɛ nneɛma a ɛsɛ sɛ yɛdi soɔ deɛ ɛsɛ yɛyɛ ɛne deɛ ɛnsɛ sɛ yɛyɛ ɛno yɛ ne Ghana Health Service foɔ ɛne yɛ development partners ɛne yɛtena ase ne yɛtintim krataa no krataa edi kan no a yɛsɛ guidelines for school reopening no ebi ne yɛ no nso yɛde akɔ akɔma schoolfoɔ no nyinaa teacherfoɔ no nyinaa ɛne ɔmo a hwɛ teacherfoɔ so regional directors ne district directors no a kyerɛ sɛ ɔmo de ɛyɛ adwuma yɛsan so tintim krataa baako bi a no nso yɛfrɛ no recovery learning ɔnkɔra no kɔtena fie no bebree wɔ hɔ no mu a nneɛma no ɔmwerɛ afifi obi wɔ hɔ a yɛkɔ school sɛdeɛ yɛkɔ yi a obi wɔ hɔ a bɛyɛ nɔnan anaa nonum ne yɛnyane no ansa ne yɛde wakɔ school na wabɔboa wo ho akɔ school ɔmo kɔ fie bi tumi tena TV ho a bi abɛyɛ no donko anaa no mmienu afei na no wada nti ɔbɛsɔre na bɛyɛ no ndu koraa abɔ apa ho nti sɛ ba ne saa sɛ ɔbɛ school na afei ɔsan ma na bɛyɛ deɛ na ɔyɛ ne nkan na yɛ a na ɛden kakra nti ɛno no yɛyɛ no kakra kakra kyerɛkyerɛ ɔmo nneɛma a ɔmo bɛtumi ayɛ na ɔmo sɔre mu ne ade saa obi nso wɔ hɔ nom a ɔmo sua adeɛ fɛ ɔte fie a timetable bi ani hɔ sisi a ɔbɛ school timetable wɔ hɔ ne yɛsesa adesua ne ade ɛyɛ a na ɛtumi de ɔhaw ne ade ɛbrɛ nkwaraa no nti saa nneɛma no nyinaa no yɛayeyɛ ho yɛtitim ho krataa de akɔma yɛ teacherfoɔ no a ɔmo hwɛ na ɔmo ne nkwaraa no ayɛ ɛno nso ɛm sɛ nkan no mamfa nkyerɛ ɛno nso nie nti ɛno nso ɛwɔ ha sɛm yɛsan so ne ɔmo a yɛne ɔmo boan me ayɛ adwuma no Ghana Health UNDP no mu ne ɔmo keka UNESCO no mu ne ade nyinaa yɛbɔ mu yɛ deɛ yɛfrɛ no back to school campaign ma yɛkyɛda kɔpa ho ntoma ɛwɔ Mankyɛabɔ na ɛno no akyire no nso yɛyɛ my first day at school nkwaraa bɛyɛ mpem 600 ɛte fie a na kyerɛ sɛ ɔmo nkɔ school afei na adu ɔmo so sɛ ɔmo kɔ school ebi afei na ɔkɔ KG anaa afei na ɔkɔ class 1 ɔmo nyinaa no na ehia sɛ ɔmo ba school foforɔ yi a ɔnnim sɛ ne school mu si teɛ na ɔno nso kora ne ti anye yie na ɔne covid aba bɛhyia no na ɛsɛ yɛpɛ kwan bi so a yɛbɛma ɔmo ani agye school no ho na nkɔyɛ sɛ ɔkɔ baako pa adeɛ kyɛn ɔsɛ me nkɔ bio nti ɛno nso yɛbɔ ho dawuro a yɛsan so wɔ nneɛma a yɛayɛ a mmerɛ so no ɛbɛba TV so ɛne radio so ne adeɛ a ɛyɛ dawuro ɛbɛma nkwaraa no atumi atena school mu hɔ no mo ama yɛn nneɛma no bi a yɛyɛ nso ne sɛ yɛne Ghana Health foɔ ɛka bɔ mu ma yɛn secondary school no titiriw ɔmo nyinaa yɛakyerɛ ɔmo baabi a sɛ nyame mfa saa ama sɛ yare bi ba anaa yare titiriw biara ba na school no ntumi nso na yɛ ana school no ɔmo wɔ infirmary anaasɛ ɔmo wɔ sick bay wɔ hɔ baabi wɔ hɔ no ma na ɛborɔ ɔmo so yɛakyerɛ baabi a school kora a ɛyɛ sɛ biribi saa ba a ɔde ɔmo kɔ yɛyɛ nkyerɛkyerɛ ɛde ma yɛ teacherfoɔ bɛyɛ mpem 52 ɛwɔ ɔman no mu nyinaa na ɔmo ɛkyerɛkyerɛ nneɛma a yɛsɛ yɛyɛ ne nneɛma a yɛsɛ sɛ yɛyɛ no ɔmo nso akyerɛkyerɛ ɔmo nuanom ne ade yɛwɔ ekuo bi a yɛfrɛ no SHEP ɛwɔ yɛ hɔ nom school health education program ɔmo na ɔmo hwɛ saa nneɛma no so ɛwɔ yɛ sukuu mu nti ɔmo yɛakyerɛkyerɛ ɔmo saa akwan no nyinaa ɔmo didi soɔ yɛne UNICEF USAID World Bank DFID ɛne ɔmo saa ɛkuo akɛseɛ saa no yɛne ɔmo nyinaa nso ɛka bom ne yɛyɛ nneɛma a yɛka yi ɔmo taa yɛkyi na ɔmo boa yɛ wɔ akwan bebree so sɛ yɛhwɛ yɛ table no so a yɛbɛhu nneɛma a sisi yakɔkyekyɛ deda no yɛbɛtumi ahu bi ba face mask a yɛama bɛyɛ ɔpepipidu 10 million hand sanitizers no yɛkyɛ mu mmienu ne sɛ nkwadaa paa no kagyifoɔ no ɔmo deɛ sanitizer na yɛde obiara nsa bɛka no deɛ no yɛmma ɔmo bi saa wode ma na wanhwɛ yi a na nyame mfa saa ma ebi a na wakɔ akɔnom anaa wɔde akɔyɛ biribi a ɛnsɛ sɛ ɔde yɛ nti no yɛnhyehyɛeɛ no sɛ ɔmo deɛ no deɛ yɛde gu toa kɛseɛ mu ne yɛde ama ɔmo atikyafoɔ no na ɔyɛ a na ɔmo amiamia gu ɔmo nsɛm nkakra yɛ schools no a yɛfrɛ no special schools no nso ɔmo deɛ no ɛyɛ deɛ electronic deɛ ɔmo deɛ no yɛ special a yɛ electronic one a yɛmia ɛde gu ɔmo nsɛm ɛna ɔmo nso special school ne kagyifoɔ no teacherfoɔ no ne ade no ɔmo nso yɛama ɔmo shield a ɔmo tumi de hyɛ ɔmo anim na kyerɛ sɛ ɔmo kyerɛ adeɛ na aboa ɔmo wɔ ɛkwan bebree so yeah sesei deɛ na wɔtwe a yɛba bɛsi mu deɛ yɛba bɛyɛ ne sɛ yɛbɛkɔ mpɔtɛmpɔtɛn bɛkɔ school mu nyinaa yɛfi yɛn a yɛwɔ nkran a yɛwɔ national headquarters ɛne ɔmo wɔ regional ɛne ɔmo wɔ district ne nyinaa no yɛbɛkɔ na afei yɛakɔhwɛ sɛ nneɛma a yɛde atoto akwan mu no obiara ɛredi so anaa ahokyerɛ bɛn na ɛwɔ hɔ ɛdeɛ mmoa na yɛbɛtumi de aboa ɛdeɛ yɛbɛtumi ne ɔmo adi ho nkɔmmɔ ne yɛahwɛ sɛ biribiara ɛbɛkɔ so wano nti yɛbue school na meka no sɛ yɛyɛ my first day at school no yɛdi ka ayɛ akɔ round ahwehwɛ nanso ɛsiane sɛ school no ɔmbɛkɔ no ma akyɛ kakra nti no ɛwɔ mu a bɛyɛ na wɔtwe anaa na wɔtwe mmienu biara no ne akɔhwɛ deɛ ɛkɔ so ɛwɔ hɔ no mu yɛn directors no ne adeɛ nso yɛayɛ sɛ ɔmo nhwɛ na ɔmo fam ani ni schools no so ne yɛhwɛ sɛ deɛ ɛkɔ so biara no sɛ biribi wɔ ho a ɛyɛ sɛ atɔ kyema yɛ sɛ yɛbɔ akyire a ne abɔ akyire yɛsan so akae mu sɛ online na yɛyɛ no ne radio ne tv no ɛda ho wɔ hɔ nti no yɛbɛsrɛ sɛ awofoɔ bɛma yɛn nkwaraa no ɔmatumi ahwɛ no nso anaa ɔmatie na ɔmde aka deɛ yɛ ɔmokɔ school akɔsua no ho na ma memfa ɛkwan yi so na menna ɔmamu no nyinaa ase nkanka awofoɔ no bebree yɛ ɔmokɔ school na ɔmototɔ nneɛma no bi de ma nkwaraa no kama ɛma ɔmode kɔe yɛhu sɛ yɛ secondary school no titiriw ɛno nso bɛhwɛ na ɔmo old boys old girls old students ɔmo nso kɔkɔboaeɛ yɛahemfo ne nnipa no bebree ɛboaeɛ yɛhu sɛ adeɛ no sɛ yɛn nyinaa yɛanka mmom a yɛntumi nko no nti nhyehyɛeɛ a yɛn nyinaa yɛayɛ no ɛne sɛ ne yɛn nyinaa yɛde yɛn ahoɔden aka ho no ɛyɛ adeɛ a ayɛ ani sɔ nti yɛda wo ase sɛ biribiara akɔ so wano ama yɛn.
Prof, thank you. Part of the brief. You will recall that His Excellency the President instructed the Inspector General of Police and announced same to ensure that his men and women step up enforcement of the mask wearing mandate. This morning, Superintendent Mrs. Sheila Abeyi Bachman, Director of Police Public Affairs, will give us a quick update from the Ghana Police Service. Sheila, welcome. So what have you been doing so far and what is the result like?
Thank you, Honorable. Good morning once again, colleagues, Afishapa, to those that we haven't met, and to listeners and viewers, greetings from the Inspector General of Police and from everyone else. So since the directive on 17th of January this month, I'll give you information related to that. But let me start from enforcement by police from last year. So I'll give you information related to enforcement by police from sometime in April 2020 to the 17th of January 2021. And then the results of our enforcement from the 18th of January up till, say, right now. And then what next steps we will take. So prior to the update number 22, where His Excellency the President directed IGP to direct his police officers to ensure rigorous enforcement of mask wearing at all public places. this is what had happened. A total of 222 cases involving 1,584 people had been arrested. You know that restrictions was not only on mask, but for other things. So out of these numbers, we sent 453 of the persons to court, and then 237 of them were acquitted. 144 were granted bail by court. 70 were convicted to serve various punishments, including fines, and 2 on bench warrant, which we are still looking for them. So what is of most importance to you and interest to you is about what has happened since 18th of January to now. Basically, what we have been doing, sensitization, and in rare cases, arrest. So with this, we have arrested a total of 961 persons. Accra has the highest number of suspects arrested. I told you that what we are doing is sensitization, and in rare cases, we have to arrest. So, and we are guided by the signs of the coronavirus and which regions are recording high and all. So Accra region has the highest of 330 out of the 961. Out of these 961 persons arrested, we had to give verbal caution to 484 people who were discharged. And then we had to give written caution to 477 of these persons, and we have granted them bail. These were done after they were all made to wear their mask and do so properly. Now, what is going to happen, or what is happening now? We are still on the sensitization, and in rare cases, we'll arrest. So we are starting the enforcement from home, which is among police personnel and our clients. So IGP has instructed, and it is mandatory, actually, for all police officers and civilians who work, visit, or are invited to police stations, police officers, police schools, and barracks to wear their face mask always and for as long as they remain at these premises. And that must be done in addition to all COVID-19 protocols, including regular disinfection of police establishments. So all divisional commanders have been given at least one sprayer, knapsack sprayer, either motorized or manual, to assist with this regular disinfection, in addition to what the government has been doing for us with Zoom Lion and others. And also at the headquarters level, we have the public health in our estates, which have a number of them who would have to go around regularly to disinfect. And so to commanders who are not doing that, this is a call for you to do it, because the monitoring team will start moving. And we have been engaging with regulators and operators. Various police departments, regions, directorates, and units engage. So for instance, let me use the MTTG as an example. Transport operators, transport owners, at the lorry stations, we have been engaging them. And particularly in the municipal and district assemblies, we have started engaging to see how they can activate their bylaws to ensure enforcement of the wearing of masks as their bylaws permit, specifically to the regions. And we hope to see results soon. We have been visiting public places randomly. So when we come to an open bar, for instance, and we notice that you are not ensuring COVID protocols, we lock you up. And for those of you who report from the ground, I'm sure you have a few cases you have already reported. But the next step that we are going to take, we are going to have random stop and search on vehicles across the country. So you could be traveling from Tamale to Accra, or you could be traveling from Ho to Hohoi, or wherever, Kwamai to Kumewu, or you could be traveling from Madina to Adenta. It could be a commercial vehicle. most especially, but it can also be private vehicle. For as long as we see 2 or more people on the vehicle, any police officer in uniform can stop you, look at whether you're wearing your mask properly. If not, you will be brought down. And if the driver is wearing properly, the passengers who are wearing their mask properly will be made to go. Until you find your mask and adorn it well, you cannot board the next vehicle. So please, let us all get on board and preach the good news of wearing the mask to ensure that we stop coronavirus. Repeat offenders. So you see that we have already recorded 961 from just 18th January alone. And then previously, we recorded 1,000 and over people. If we arrest you in this next step, and we realize that you are a repeat offender, you leave us with no choice than to find a provision under the law to prosecute you. Now, let me make a special appeal. The IGP wants to make a special appeal to the public, to the media, and human rights advocates especially, to join efforts in reaching out to the masses to wear their face masks at all times at public places to protect all from contracting the deadly COVID-19 disease. Thank you.
Thank you. Sheila, before you take your seat, if you can just give us a summary in three.
Yeah, but be a friend of random stop and search. Regions ni bi oha ebi now experiences almost started, but we are nationwide. Baby, you be who say car enam. Titi commercial vehicles. Se nipa mienu miensa airco ene timwa. Police near oshe uniform. Men can see they say police near oshe uniform. Or perform duty bia say ye highway patrol, say ye traffic management, say ye me me kasa na me nampo na me hia no. Ye betimi agina wo. Na ya hwe say nipa atim no obi a hye ne mask ni yie se ne a doctor for na church and aban church and say yen sha na. De on hye bi no ye be yinasi fom. Just wa pe bi a hye. Ansa na watoa na kwentuo ni so. Ye yi wusi fom a ye nyai omo a omo hye bi kama no enso ene enyina ho da bi. Omo de ye be maka no e de omo akọ. Say driver ne nhye bi a in fact a driver for IRDS abesisa abre mi di kind da GPRTU for ni progressive for ni ade ase. Enti driver bi a hye bi. Passenger for na hye no mo hye ni ye no. Ye be mo de omo akọ. Na wa wo nhye bi de ye ma won fro car bi age se wa hye ni ye. Enti ansa na be fie di wo fie na onim se be bia akọ ni power de yesrew. Now mask no wa hye no ye ama ye now they abo ho ban. Na appeal like wo ho no. Aha repeat offenders no. Yes, say why ya choda. Say yes I choose say yeah. Ya do be court. Ya do betum ansa na ye do akọ court na mrama ye ho kwan ye nim procedure e be fa so. Ansa na akọ court a court nso so e the punishment e wo ho ama. Enti yesre mu. Memma unye bi ma ye nchewa menye bi. Won so so a one show mask nti ya choda no. Efri na ekro ye gidi se wo ye ne a etene wo be show mask ansa na wesi abonten na we afraid enti IGP appeal a opese oyema obia efasa enforcement yi ho ene se titi umunsem trefo ye da mo ase ne a moye e de support enforcement yi na omanfo etiefo nyina any human rights advocates yempese ye behwe obia o Ghana nti esre mo nyina mo nka mo ayen na yentimi entu amanfo ofo no mo nhye mask no and no say obi send a message our police Facebook page say mon hwe papa we mi hu no nhye mask na police ni ba nso wa ama na anyina ho na wo say anu ye be na de ma no onso wa aso die say obeka kire nipa ne say eja ena abayo abrantie hye mask no na hye ni ye na de bo ho ban de abo me ho ban de abo obi a ho ban ye da mo ase.
Sheila, thank you.
Honorable Minister, I think beyond the coronavirus, we still manage all the
other cases.
cases,
So you are
but
not
they are
just a
still
corona
there.
doctor.
Yes. Thank you very much. And I think I'll be as brief as possible, but I believe that we've had a lot of opportunity, but I think we want to ensure that the new areas of schools and enforcement is also given the necessary attention. So I'll speak briefly about the epidemiological situation. How are our cases, what's happening in KIA, and what are we doing in brief on to manage the surge? I will say that the number of new infectious cases still remain high, but has stagnated in the last few days. So we still run between the same numbers we have. That's about between 600 and 670 thereabouts. So that's where we still are. So we are not seeing the rapid escalation that we saw earlier from the 300 all the way to 600. Active cases continue to rise as a result of the surge, and we are hoping that if we stabilize the number, the recoveries will increase and the active cases will start coming down. The cases are mainly in Greater Accra, located in Accra Metro and its surroundings. I'll show the heat maps and the spots that we have. And the case still remains the same characteristics of middle class, but now we are also having some increasing workplace outputs. Once it starts from the homes, we take it to the work, and then it starts affecting us. And the travelers still continue to add to the numbers who are coming in, but we have seen a decreasing number of positives coming from the travelers. So, in summary, the total number of positives we have ever recorded is about 63,883. We have tested about 757,000 plus, with a cumulative positivity of 8.4%, and our current active cases is roughly about 3,940. We have recorded 390 deaths so far, and you can see that there's been a rapid escalation in the last few weeks of the number of deaths. Today we are reporting a new total new cases as at 25th of 2025 cases, and the majority, as we keep saying, are in Accra, not Accra Metropolitan, Ashanti second, followed by Western. Currently, all 16 regions have active cases, but as at this current report, 10 regions did not report any new case. So only 6 regions reported a new case in this reporting period. All of them had no case, which is a good sign. Zooming in on Accra, which is our main spot, the number of contacts is about 330. The total number of contacts listed in this as at 27, that's just January, is about 8,679. Contact listed for just yesterday was 536 new contacts. So far, they followed about 8,043 contacts, and out of them, 283 of these 8,000 contacts have turned positive, giving a positivity rate of 3.5% of those who were contacts. Once again, once you look at Epic I think you can see that it's still you look more at the last spike, which is what we are dealing with. We are hoping that we may see either a plateauing or stagnation or whatever it is to see how the numbers may start coming down, depending on what we do. And I believe that we have all seen some improvement in the adherence to protocols, but I think if we continue, we'll be able to do much better than we are doing. The same thing comes in here as you see the weekly samples taken that have been taken. You can see that the significant number of the samples taken are contacts, and we'll talk a bit more about the contacts and how it's affecting us. You can see that the positivity continues to go up, but it's, like I said, it's stabilized in the last few days. Let's hope that we go there and we start coming down. And the same positivity, so you can see what I'm talking about now. And then we have the next graph shows somehow the active cases, and this is a very familiar chart that we are all aware of. The deepest being the Greater Accra, where we tend to have more cases in the country. Okay. So next slide, please. So you can see that if you look at the monthly distribution of cases, a significant number are all in Accra. Accra is the blue color. Active cases by day, we continue to rise, as you can see, and that is what we should be worried about. And that is the number of people who are currently carrying the virus, and we need to be worried about that. We are doing about 3,900. We are hoping that if the current strength start coming down, the active cases should start coming down, as we've seen before. And this is the test conducted. You can see that with a surge, you are doing more contacts, more tests are being done. And so we are on average doing about 3,500 tests a day. As you said, the age distribution hasn't really changed much. It's the same group of 25 to 40 and up to 60, where we have the more active ages. That is where we have most of the cases. So the 625, and this is the important area, they are coming from 34 districts in 6 regions. Greater Accra has about 84.8% of these new cases that we are reporting. We have Ayawaso coming up, because that's because there are a lot of labs there, and that's what, so not necessarily the Ayawaso people. Ashanti reported 15 new cases in Kumasi Metro. Eastern had 44 new cases, and so there's a team trying to observe what is happening in Eastern region at that time. The New Jabin, Sujaman 20, and West Akim is what we are having the cases of from. Central reported 2 cases. Upper West reporting 15 new cases, 12 in Wa and 3 in Nadoli. Volta reported 10 new cases from Pando, who had 4, South Dai 1, South On 3, K2 South 1. And as I said, the remaining 10 regions did not report any new cases. And the airport reported 3 new cases. As I told you, that the number of people who are testing positive at the airport seems to be declining. We hope that that trend will continue. Now, if you look at the next map, you're trying to see where is the concentration. I think where we are concentrated, also where everywhere we need to be risk averse everywhere, but this is where we need to be more concentrated. You can see that there's Accra Metro in this environment, as I mentioned. We also, some of these heat maps and blurs to allow people to see. If you move to the next slide, you can see where, this is just Greater Accra, where the clustering is, where the cases are. Okay, and so it doesn't mean that the other places are not risky, because it depends on where you are standing or who you are with. And so, but you can see that the central Accra Metro is where we really have, and this environment is where the concentration is. And if you have 650 and about 84% of them are coming from Accra alone, that tells you that it's still a very, very hot spot that everybody must be looking for. If you move, as you do the heat map, you can see where the danger really is. And so this is important to see how we look at that. Starting from tomorrow, we are going to start assessing the adherence to the protocol, especially mask wearing, and we're reporting periodically to see how we can encourage everybody to escalate. And we are asking the media to be part of that. At least they can even also help us do some, even if an unscientific assessment, at least let people know that it's important that people are not using their masks. The admissions, as was said the other time, continue to be about the same, but we have seen some, the surge is, we are not out of the woods. We still have a lot of people on admission, but we are not experiencing that increasing wave that we saw earlier. The critical cases are still there, and so we have also expanded our capacity to manage. The airport, just a short brief on the airport, is that a total of 1,112 cases have been reported from the airport. They've done a total of 147,000 plus tests with positivity rate of 0.75. But I can see these are the daily numbers that are seen. If you see the nature, you can see that there's a rapid decline in there. Let's see whether either some restrictions in parts where they are coming from, or adherence is also from people who are coming and improve. I want to hope that this continues to decline. You can see that January alone at the airport, we have recorded 407 cases compared to 42 in September. And so, but now that it's tapering, we are hoping that probably February will be better than probably November. If you look at the positivity, Tuesday it was 1.39. Now it is in January, now it is dropped over 1.36. And let's hope that that continues to look at that. The rest is just the usual countries of departure, has not changed much, the same Nigeria, US, UK, in that order. And the flights on arrival is the same, our BA, etc. These are all the same numbers that are coming up. So what are we doing with the issues? I think this is where probably the linkage to care is hampered by institutional and self-referrals. What do I mean institutional referrals? Especially a workplace outbreak, you'll say that, oh, you are there and HR manager calls you that somebody has 10 positive, so go and get tested. But that's not contact tracing. When you have that, you report to the health sector around you. They come and do a risk assessment, identify the positive, because the people who work with you, they live in communities, they belong to clubs, they belong to gyms, etc. So the health sector can map all these places and do a proper contact tracing. Also self-referrals. So you go, you get tested, you get your results. It may take a couple of days if the lab doesn't enter quickly, for the health sector to identify and respond to you. So the most appropriate approach you are encouraging people to do is that as soon as you feel unwell, please report to the nearest facility. They will give you a referral, and then you go. So once you are going, they are expecting your results. And so even if it doesn't come, they are following up to see whether, even if it may be a false negative, for example, especially nuclear symptoms, etc. So I think let's make sure we do that. But because people have elected to do that, we have also put data entry clerks also at the private sector labs. And we have seen some improving number of data entry, rapid response, and linkage to care. We'll continue working for that to ensure that the link, especially for the sick, is done promptly so that we can save lives. We have improved access to testing by expanding, creating additional labs. The Ghana East lab will start by Monday. They'll start doing labs there. But we are also saying that, as the minister said, it is free at the public sector. What we are looking for is this, as soon as you go and you are referred from a health center to or any health facility to the labs, it is free for you at the public sector, free. And that's what. So apart from those who are traveling, anybody else who goes there is free. But it's not that it's not mass testing. So you are not just going to go to the place and expect to be tested. Once you have a referral to the place, obviously you'll be tested. And that's why we are encouraging that. Whatever it is, even if it's a cheap compound, they will give you a referral to go and test. And then you can have link. Because it's not just about knowing your status. The most important thing is, if I'm positive, what should I be worried about? What should I do? And that's more important than being positive, especially when we have asymptomatic people still around. The daily tests continue to rise, and we will continue to rise. The contact tracing has been expanded. And one of the key issues is also the fact that non-adherence to the protocols. We plead with you that please continue to adhere to that. On the area of schools, so far, Prof, we've been quite, so far we've not reported any major cases apart from the Upper West one, where apart from the 3 from 2 schools, 2 were from 1 school, and then the 3rd from a 2nd school. We did a contact tracing for 34 of them, and of the 34, one turned positive, and so that's why now that makes it about 4 cases in Upper West, and we have 1 case in Daboase still. We have no more received any report of any outbreak or positivity in any school yet. So, in next step, let's continue intensifying the adherence to protocols. Let's promote decongestion in workplaces. We'll send another circular around that. Encourage virtual meetings where it's possible and work from home. And when we say it's about workplace, ensure that you have sanitizer at the right places. Ensure that even the vehicles that you use, people are able to sanitize. Get the janitorial people who are doing cleaners to ensure that certain surfaces are periodically cleaned. And of course, ensure the appropriate social distancing and adopt mechanism that allows less people to be congested. Because it's a chronic mass gathering, just like we are doing here. So if you are not wearing masks and we are here, and there's a tendency to feel comfortable that my sister or my friend is okay. And so please, we need to really emphasize it, because that's the major place where we had a lot of the outbreak, or that one that we cannot do away with it. We also, as much as possible, let's minimize indoor activities where we can help it, dining, etc. Should be done. So, Honorable Minister, this is what we have. Thank you very much.
Doc, thank you. It's still very high. The target is to bring it down to as low as possible. How do we do that? Is by ensuring that all the things that he's been talking about, we communicate it and then we comply with it. He also makes the point that there's increasing workplace outbreaks. What does it mean? People in an air-conditioned room, people using the same lift turnstiles, the same lunch room or cafeteria.
The same doors,
opening the same doorknobs, etc., are recording a lot of cases. You recall that the earlier part of this wave, the data suggested was that it was people who had gone to a lot of social functions and were sitting together, and even though you've worn the mask and checked your temperature and sanitized your hands before you get there, once everybody feels comfortable and then you take it off and we are eating and we are chatting, then the risk is way higher. Now, the data suggests that a lot of the new cases they are getting, they are workplace outbreaks. And that's why he's making the point about ensuring that the workplace preventive etiquette is followed. So I beg of you to highlight that a bit more so that HR managers of offices, etc., also pay attention. Another thing I want to highlight, current case count, 3,940. 3,940 active cases as we speak right now, 3,940. That again is still high because the percentage of those who will be sick or who will be severely or critically sick out of that will mean more nominal numbers. And therefore, if you don't have a lot of ventilators and ICU facilities, etc., then the case burden is getting higher. So we all have to contribute to ensure that we get this 3,940 down as quickly as possible. And in the last outbreak, 10 regions have not recorded a new case, thankfully, in this reporting period, but 6 still are recording cases. And so we need to get the word out. Even though all 16 regions have active cases now, in the new count, this is where we are. One of the things that excites me, Doc, is that contact tracing has been stepped up. At least in Accra alone, about 330 contact tracers. And you've been tracing about 8,679 contacts. So I think that's some good news, that there's some aggression on the contact tracing side. And then the clarity you've given us, let me be sure if I got you well. You said referrals to public labs are free. So it's not walk in to a public lab. It's a referral, which means you've gone to some healthcare facility and they have referred you. And that's critical, referral. And you're talking about public lab before it becomes free. So this circular that you're seeing going around, we beg of you to help us explain it to your audiences. And please help us to step up the general communications, because we're noticing from the data that as we step up general communications, people respond. So we're grateful. Let me ask that we set up the microphone and then we take questions.
You're concerned more about the inconvenience that will be caused people than the spread of coronavirus and death, I guess. So now people have been told, listeners, viewers have been told to wear your mask anytime you step out. We are concerned more about stopping the spread of coronavirus and stopping death when you compare that to inconvenience. So since you have been told, we will not take that excuse that it will inconvenience you. We, the police officers, will be there to enforce it. Would it be inconveniencing us? So please, you may be creating markets for somebody else, but that is not our concern much. What we are concerned about is that you are protected. I am protected. Everybody is protected. So the good news has come at this time for us to get the mask anytime we step out of our house, anytime we're going to public places, be it a bus or a commercial vehicle or wherever we're going that is considered a public place. For as long as we see 2 or more people, if it is a car, we will stop you, if need be. And you will have to wear your mask. So don't give us the inconvenience of having to drop you off for the other passengers who are law-abiding to continue. Please, we beg. And this is being broadcasted live, and I'm sure our media friends will continue to tell you so that it doesn't inconvenience you. Because if we have to choose between convenience and COVID spread, we will choose inconvenience. Cells, social distancing. So home-based TV. We say a question no tree say mama did that cells no I record the cases or cells. Na yeah contingency measures I say and sa na ye beche wa ye do beto cells no. Yan so health for ya chire and yema yenya yenhwe. Enti no yemfa new suspects enka old suspects ho. Na mom no sane enam se ani omudi nsan so enti na yekoso a test inmates no sane ayemfa new convicts enko prison no se koba se bibini ne a convict obi anase bibini na wo se health for ne be test no mo test ya na se hu so ye positive but ebi mu ho a omo ye negative a eno so ye were dedicated cells within divisions ye foul edo ko ho because ho na health for no be di akire abehwe aba manage cases no. So our contingency we there, we hope free April 2020. Enti yekoswa enesa. Na mo amunim say obi a wa test positive wo yen cell bia anywhere owuye or recover ye. Say if I can get the stats right, and nipa dodo a tested inmates so far 131 inmates and tested positive or police asweye omo figures are up to last week, omo nyina recover enti that is what it is. Workplace, public place, say and there you can am hu dada enti no me my example be to say drinking bar and mama example to say car mu enu enti no adwuma mu so ye workplace ye random search no etimi de ba ho na eno no ne aye pi ene operators ne regulators adwumamfo momma yanya ne a mienso ye be ya nipa ho be henhan momma mo ntwan ma police mera hwansa me ka kire on hyehye ya yanya police yaye and into social gathering bit say wasa nka January mu hu say esisu to campaign ye kra ye jai yenye enti say adwumam ye consider ne say a public place in Kwade at any point in time police may come in there and do random search to ensure that you are abiding by the COVID protocols. Thank you.
Thank you.
Specific time, you can start now because you have been told. Thank you.
Thank you. Director General.
Incentive for teachers. Let me say that since 2017 up to this day, if there is one group that have received a lot of incentives, probably is teachers. They have. I know that, like Oliver Traced, we always say that they're small. But as far as incentives for teachers for COVID is concerned, probably if we are looking at incentives, then we should also as well be looking at the students as well, because they are all at risk in a sense. I think what we all need to do as the health officials continue to tell us is to ensure that we abide by the safety protocols as strictly as we can, and we will all be safe. So that is what I can say for now. There was a question on general assessment of the reopening.
Yeah, the first 2 weeks. What do you make of the first 2 weeks?
Yes.
We don't have much time. So
The first 2 weeks, I would say that so far so good. And as I've indicated, we are going to go out now to do more monitoring. Reusable masks. The masks are reusable. The masks are reusable. And we are indicated that we're giving 2. Let me make a passionate appeal to all. I have already indicated that parents and other people are helping. Let me make a passionate appeal to all. The issues that we are dealing with is about our own health. So much as we employ government as a responsibility to support us, we should also see it as a personal responsibility to ensure that we also support government and support ourselves. So government provides some. You also have to make sure that you continue to provide for yourself and your wards. Admission into schools. So far, in my schools, which are public schools, there's so much space in there. I don't have so much problem in there. Probably there are some private schools that may have issues with admission issues with the space and all that, but we have not recorded any challenge as far as admissions are concerned in the public schools. Yeah. Instructional hours, 6 hours for primary and JHS, 7 to 8 hours for SHS, KG 4 hours. And obiso bisa school bia nsaka ne PPE sana. Se school bia nsaka ne de sisi ayi ntumi nka. Yenim se enema no ekosisi am begyina ha se mo ya na asem wa yi so. Enema no bia kwakodu Ashanti Regional. No mo pe district kroni ade. Nti na se ye send list de kokomo mti enim se enema no de ni nyina no dodo na ekọ. Enu nti ne se na wotwe ebesimu no. Ye tie ho agum ni akọ enye se ye kọ district officer na se ye kọ school na mu ni ahwe be bia ebia akọ mame fansan kan so se ade ba ko so aye hunu ni se eya na ye aye nkofo omo ehwe ne ma no so no ye ya ye won kran ni bia original office ni be ye fam de enso dumri bia na ne ma no bia tom me deputy director general ko school bi mu wo nkran he ya odogo no ho ba bi okoye no keji class mi no ba ko ye 47 nkora na foforo so owura class ba ko no mu no nkora na ye 11 obisa head ne se na omunyina ye keji 4 keji 1 keji 1 na keji 1 na de na wonche o mo se madwen ma so enso ya bohu dawura enti na emre bi so e ma kwan so mo nche mu no so o ka se bia omo ye aduasa de be broso no for omo ko class foforo se ba ko pe kra broso na odna ko tran class foforo enti se ni ya anhemra se omo ye aduasa for omo ko se wo ahwe number no na hwe se ne obetimi esi aye no
private schools, I think that's another part of the question.
Private schools no de omo no bebre na ya na omo kwara no kra ya na omo tesha enti omo na ya na menyi se omo wo saa.
The question is that the distribution of
PPEs no ye ne private schools nyina private schools nyina tina otwe besim ye beko ne akwa say monitoring be cost.
Prof, thank you.
All right, thank you. So I start with Kojo, City News. You are asking how we will know repeat offenders. We keep a record of it. In fact, the arrests are being made within jurisdictions. So police officers have a way of identifying offenders. So that's not a big deal at all. Our police officers considered frontline health workers. We are not health workers, but we consider ourselves frontline officers. If there is any advocacy you want to do for us to get any benefits, thumbs up, we would like it. But there are some health officials amongst us at the police hospital. There are actually some people who are considered not only as police officers, but also as frontline health workers because of what they do. The finder, You said you were arrested, you were added to some inmates. How do you know whether they were also new inmates arrested on the day? I think sometimes we make some assumption that does not help, especially when we are communicators and we have the platform to communicate to others. Those people you met in the cell could have also been fresh inmates arrested for the purpose of setting up that cells for fresh inmates. Because what I said was that our contingency plan is to put new inmates in a separate cell. So that is what it is. Stop and search, the finder. You want to know how police will keep it up. It's going to be random. We're not going to search every vehicle. I'm sure it will be difficult to do that. It's going to be random. As much as possible, our concentration will be on public transport. And then the timelines, it will all depend on what is going on around the world and particularly in Ghana. So stand-down will be given to police officers by the Inspector General of Police in accordance with law. So it can be any time, depending on what instructions come. Akokraba Kantri, or see, Edian na yebeya, police for ebejinejina, commercial cars and other vehicles. Asha se ubi she mask na emfa confrontation ema. Akokraba meda se pa, yemfa kwenya isumo manfo hu se. Yabomo koko, intermedia for munkoso anchechero manfo. Yempem pintin bia. In fact, se car no ojina yen so mu. Instructions near the bema, and it's a lawful order that you must obey. Entika na jina ye US form. One kasa obey you who crazy form. If it's a moment when China won't share mask, no you're very uncomfortable. But omo nimni omo catch. Enti police jina e you amode driver na kasa kra be mo wesi form. Na omo ebum raso no. Ya mo omoko. Enti asremu mamu mani no situation a ye be jina car ye be hwem no na kyese obi de on share mask ono nso so a oni bi. Obiam pebi na onfa money ho ban no onfa mo yensie ho ban. Manuel, I think your question was answered. Thank you.
Thank you. Prof.
Yeah. The reopening hours that we're giving, generally we give to public schools. Some of the private schools elect to follow it up. But as I indicated much earlier, the students have been home for a while. So once they are back, we will advise that we restrict them to the new hours that we've given. We've heard of stories of some schools going from 6 to 6. It doesn't help. You may get the children to break down. So we do that. But for the private schools who are doing that, the National Schools Inspectorate Authority, it's working to ensure that they also are in line with all the guidelines that we are giving. The parents' assurance, I think I've given it a couple of times, but I'll continue to give. They are well assured. Once they also do the part that they are supposed to do, ensure that before your child leaves home, he has the face mask on, and also maybe you give him or her some pep talks on what to do and what not to do. We also ensure that the teachers follow those things. What are the sanctions? The sanctions are the general sanctions that they apply to everyone. We don't have specific sanctions for teachers because you are in the classroom, but they are the general sanctions that we all have to follow and ensure that we don't fall foul of. Then the number of students who have returned. The number of students who have returned, as of now, we can't give you the specific numbers, but we know that several of them have gone in. What we're doing, when we go on our monitoring, we'll pick those numbers. But let us also say that because they've been home for a very long time, we don't expect that all of them at a go may go in for a number of reasons. So part of the program that we're doing what we call re-entry and readmission for especially vulnerable people, girls and things like that, who may have fallen out for one reason or the other. And then we're also doing we are intensifying our enrollment drive for people to go to school. Around this time, there are certain areas in the country where they are in farming seasons and things like that. And it's possible that parents may want the children to go along with them with the farmings and the fishings and things like that. But once we continue to do the enrollment drive and the campaigns, and let us take this as a national assignment for us all to ensure that everybody gets in there. Thank you.
Thank you. Doc, were there questions for you? Yes, please.
Thank you very much. Maybe I'll start with the CTFM question about the oxygen and critical stuff. I think that is what makes coronavirus a unique challenge. Availability of oxygen is not Ghana alone. It's a global challenge for critically ill patients, especially with COVID. But what the most important thing that they continue to expand, escalate the amount of oxygen that's available not only to RAGE, Ghana East, etc. We are putting up new oxygen plants to be able to generate. We are buying a lot of cylinders that are building. So we continue to expand that. And I think RAGE, they also have critical care workers like critical care nurses, anesthetists, who also are doing other things. There are places they have to curtail, I would say, elective cases to be able to do it. And that's what most hospitals are doing. As we speak now, we are training about 55 or so critical care nurses and doctors to be able to risk up the expansion to look at that. And so I'm not surprised that is coming, but we continue to escalate. And I'm sure if you are giving the numbers, especially RAGE with the 16 ICU beds, we are giving them enough to be able to manage that place. The free testing, I think I'll say it in Chi. Yes, say, test, no, you will quite fast your test. We want to do call hospital. Say CHIPS compound, or be able to be no. Your different case definition. If you want some, no, let's say, say a say call lab way no call. And I say, better take your sample. Na dia call. Na akoye. Na results no abro. Eno no free. Ye wien so a obia or your contact bia no. I nim say we expose. Ni nyina kan nipa no ho ambekwa free. In any public health lab abeko bia no. No mo betua obia ebia wo kose okoye test because of pursue to kwan. I don't know the passport connect here and then na OTS also tia no na akwakoye. Inti free. So the free is about not self-referral, not just feeling that, oh, I want to test, and then you go. Otherwise, we have people who are testing every other day because, but we have enough test kits. We had a problem with the test kits earlier on, not because of lack of funds. That was because even if you had money, you couldn't buy. But now they are available, even in country, and so we have enough test kits to be able to respond to the challenges that we just responded recently with a hike in the numbers and, of course, the number of tests that was required. Statistics from workplace. I can't give you specific data, but you see, the workplace issues that if you have, for example, now we are talking about 9 workplaces that has reported cases. That can be a potential explosion. Remember, there was one factory that you had 550 cases. When we finished, we were about 780 positives in that factory alone. So even one workplace outbreak is very, very risky. So we don't wait until the entire 100 or 200 people working place become infected. So, but if you look at the October ending November outbreak, it was purely workplace outbreaks. And that's why we are trying to emerge. Because as it moves from the community into the workplace, it goes back into the community. And the workplace, like I said, is a potential mass gathering. That is unavoidable. And so we need to be very careful about that. Now that I have opportunity, I think we also have to look at the churches. Protocols in churches and our mosques are quite low. Please, let's ensure that this is done. We go into places and you have 15 people on a small podium like this singing aloud without mask, sharing mics. And I think we need to raise that issue, and that's another potential place that can be a spread. Thank you very much.
First to do with the borders. So, you see, all this COVID-19 response program, as we keep saying, is the data and the science that is guiding. There are things that you may think it is true, but the data will not support it, or the data does not support it. And it's not a crime if we tell you that the data does not support that which you think is true. So, for example, borders. There's no data today that suggests that illegal entry through borders is contributing to the increase. The data today shares with us clearly a scenario that says that you can see people through the Kotoka International Airport who are testing positive. That is not illegal border entry. You can see people in workplaces who are having outbreaks and are testing positive. There's no data today suggesting that X person came in, and when you trace it's because he came in through the borders here and there. So what I can say to you is that our borders remain closed. Our security agencies continue to man those borders. They were not closed for any political purpose. Our security agencies continue to man those borders. Second, the $150 antigen test at the airport, as we've said a number of times, those tests are administered by a private organization. So it's not government that is taking that $150. Government had to select that solution because it is what gives us a very fast, or the fastest way to know whether you are positive or not, and therefore allows us to open our airport but protect the Ghanaian population. Now, before you board from your country of origin, you have to demonstrate that you have paid for the test. If you haven't paid for the test, the airline will not let you board. So you can hear a rumor that somebody came in and paid somebody and entered, but you cannot board if you have not paid for the test. Those are the rules that have been laid down, and it is our understanding that those rules are being respected. So, colleagues, I want to thank you for your time this morning. I know we dragged today. Thank you for your time. We will see you, God willing, early next week.